You know, it wasn't long ago that we were talking about the importance of making ourselves aware about breast cancer, and we were focused on Breast Cancer Awareness Month. As a matter of fact, I went through a 3D mammogram myself during Breast Cancer Awareness Month at Southcoast Imaging. But here's the thing, it's so important that we not only focus on this one time out of the year, 1 month out of the year, but we need to make ourselves aware every day of the year. It's so important. And joining us now is the Medical Director of Radiology here at Southcoast Imaging, Dr. Patricia Shapiro. Thanks so much for joining us. It's so good to see you again, Dr. Shapiro.
Thank you, and welcome back.
So let's talk about this because, you know, so many people focus on breast cancer and breast cancer awareness, I think, you know, during just that month, during Breast Cancer Awareness Month. But it is important for us to not forget about this and to make sure that we stay aware.
We see an incredible increase in the number of women who get screened during October, and then we see it fall off during the first part of the year. And we really would like to have it so that people are thinking about it and making sure that they're getting their mammograms on time during the entire year.
Why is screening mammography so important for women 40 years and older?
If we detect breast cancer when it's either stage 0 or stage 1 disease, virtually 100% of women are alive at 5 years.
Dr. Shapiro, you know, there are a lot of common myths out there where breast cancer is concerned. I'd just like to hit on a few of these, and I'd like for you to respond, and let's just tackle these one at a time. You only get breast cancer if you have a family history.
75% of women who are diagnosed with breast cancer have absolutely no family history of breast cancer. The ones who do have a risk and have a family history, those are the ones that are supposed to be checked for the BRCA gene. And they have a higher risk not only of breast cancer at an early age, but they also have a higher risk of ovarian and colon cancer.
How about this one? I'm sure you've heard this one. I'm too young to worry about breast cancer.
Okay, if there was one population that I could absolutely beg to come in and get their screening mammogram every year on time, it's the women between 40 and 55. Premenopausal women have probably the highest risk of dying from breast cancer of any population that we deal with. Their hormones are still active, the breast cancers are more aggressive, the breast cancers grow much faster. And so having them come annually, beginning at age 40, is incredibly important. The recommendations are to get a baseline at age 35 and to have annual screening beginning at age 40.
So listen to this. I was called back for extra views after my mammogram. Well, that must mean I have cancer. So as you know, and I've been very open about this, I had the 2D mammogram and I did get that call back to come in for a closer view. So I very well know, I can remember that feeling, oh no, here it comes, because that's the first time that that's happened to me. I probably am going to have cancer.
And there's no question, your reaction was exactly what we see from most of the women that we work with. And we would prefer that they think of this as being a continuation or a completion of their screening mammogram. And we're just bringing them back because we've seen a small change. We've seen a shadow. We've seen perhaps a possible nodule in there. And this most of the time turns out to be, you know, either superimposed breast tissue or it may be a benign nodule like a cyst. But once we've seen a change, we're obligated to work it through and make sure there's nothing hiding in there that's more dangerous.
How about this one? Breast cancer always comes in the form of a lump.
Oh. That's the most common finding that women self-refer. But the other findings that women need to be looking for are things like thickening of the skin or redness of the skin. It can be what we call dimpling, where the skin is just, you know, tucking under, or where there's retraction of the nipple, or if there's a nipple discharge, such as particularly a bloody nipple discharge. All of these are cause for concern, and our suggestion is that they speak with their primary care or OBGYN if they have any of these changes.
And that's why this 3D mammogram is so incredibly important, as I've said here on the Southern Scene. Can you explain to our viewers the 3D mammogram?
It's just as if we were to open the book and all of a sudden we can turn the pages and we can see through the layers of this breast tissue to be able to find the small cancers that are hidden in there. It has made a world of difference, and the number of women that we are now have found in the last year and a half that we've been doing the 3D mammogram is absolutely amazing. I mean, our confidence level is higher, not only to find early breast cancers, but to be able to tell there's nothing there. And so that there's nothing hiding, so we don't need to recall women and raise their anxiety levels like what happened with you.
I just want to thank you for, providing us with all the information that you do for our show, The Southern Scene, and for everything that you do in our community.
And I'd like to thank you very, very much for helping us to get the word out and educate people about how important getting their annual screening mammogram is, and to consider having the 3D mammogram, because it's definitely a better way to go.
Thanks, Dr. Shapiro. We'll be back to see you real soon.
Okay, thank you.
If you'd like more information on the 3D mammogram or Southcoast Imaging, all you have to do is go to the information you see right there on your screen. You can also send us a message here on The Southern Scene. Go to our Facebook page, The Southern Scene, or go to our website, WSAV.com. Just click on the Southern Scene page.